House Bill 358 by Representative James, enactment Title 40, and Section 2, and Act 96 of 2016, regular session, relevant marijuana for therapeutic use.
Senator Mills.
Thank you, Mr. President. Members, on Saturday we had a really good debate about this issue, and I have to tell you, I hear you loud and clear, because I think the central piece centered around inhalation. And Senator Claytor had an amendment that basically made inhalation a prohibitive act. So what I did is I kind of went back to the drawing board, and I went to my pharmacy that night and took a picture that y'all all can see that should be on your desk. And that picture should basically show you three things. It should show you the same drug, which is a drug for asthma, and this parallels exactly the argument that I'd like for you to consider, or the amendment that I'd like you to consider. But when you look at this, it's a drug called albuterol that is used for asthma. So if you look at the middle picture, you'll see the liquid albuterol, and that's given to someone that has asthma on a regular, continuous basis. But let's just say somebody had a really quick, you got the picture, Jack? Oh, they picking up the picture?
Senator Mills.
Oh, it should be on the desk. No, keep in here.
All right.
So members, just one more time, the liquid portion is right now what's legal in the state, that a tincture and the liquid portion can be manufactured, and that's legal. What I'm asking you to consider is it would be a metered dose inhaler, which you see all the way here with the box and the inhalers at the bottom. So what I would like for you to consider is I have an amendment that really basically talks about what's the definition of a metered dose inhaler. Not just inhalation, because I could hear you loud and clear that you were worried that it would be vaping, it would be different types of things. This defines what this instrument is that you see in front of you that you would use if you're an asthmatic. It would be the same delivery system for the medical marijuana program. Now, where this is really beneficial, let's just say you have cancer, or you have pain that qualifies for this, intractable pain. If you need a quick dose of this for the pain, it would be in the metered inhalation form, and that metered inhalation form would get you a quick reaction immediately, because it would not have to go through your digestive system and through the whole breakdown chemically of it. And the parallel I wanted to show you is this basically shows you that in the pharmacy community, many times you have the same exact chemical, but you deliver it in a different mechanism. This picture here is orally, in a breathing treatment, in a nebulizer, and in a metered dose inhaler. So what I'd like to do a better job this time is basically saying inhalation is not legal. Keep Senator Claytor's amendment on the bill, but define that it is permissible to use a metered dose inhaler. And I have an amendment that basically does just that.
All right, you have an amendment?
I have amendments by Senator Mills. It's set number 3222. 3222.
All right, Senator Mills on the amendment.
And it basically says in the amendment, nothing in this paragraph shall be construed to prevent the Louisiana Board of Pharmacy from permitting by rule, so they promulgate rules, medical marijuana in a form to be administered by metered dose inhalation, which you see on your picture. That's very common practice for metered dose inhalation. For the purposes of this section, metered dose inhalation means a device that delivers a specific amount of medication to the lungs in the form of a short burst of medicine that is usually self-administered by the patient. So what I've tried doing is I've heard everybody loud and clear that inhalation is not defined. This clearly defines what the purpose is, and it clearly defines that you cannot go out of these boundaries. So I'd like you to consider the amendment, and I think it adds clarity to the legislation we talked about Saturday.
Question?
Thank you, Mr. President. Senator Mills, I pulled up the archives last night to refresh myself on the different things that we had said, and there's a couple of years worth of debate, but when I looked at the debate, one of the things that it appeared that we promised people from my review of it is that we wouldn't be going in the direction of inhalation of marijuana. And so I heard your argument yesterday where we were talking about, well, maybe we didn't consider the science as it relates to the delivery of the product, that might be other ways to have it other than just taking it orally. And you had an example that I said I wasn't willing to accept, but help me understand how this doesn't go contrary to what we promised people.
That's a good point. What we did, and it was expanded on when we passed the legislation back, in 16 or 17? When we passed it, there was a set of debilitating conditions that were allowable. That was expanded by the legislature and signed into law by the governor. One of it was intractable pain. What has happened as this has all evolved, they have found out, and I think you'll have that with legislation this massive, that there'll always be tweaks as science finds more and more things. But specifically, and there's friends of ours that have kind of talked to us maybe about this, it's just the science has evolved, and I think the inhalation piece that was talked about for a long time was the inhalation of the raw product. It was the inhalation of expanding marijuana to a recreational phase, or taking the legislation that we passed from a liquid form that was distilled down to the lowest form of THC and expanding it to where you could smoke it for medicinal purposes or inhale it. I think this really narrows down that concern, and it still lives within the guarantee we've made to folks. It just really, really narrows down that this is not smoked. It is not a raw form. It is not an inhalation piece that would be done basically to violate the intent. It's just the delivery form of the medication concentration that we approved.
All right, so that was a lot there, and I want to break that down a little bit. When you said that it wouldn't be in the raw form, what are we talking about that would be inhaled? In your amendment, it says medical. I guess it is for some folks a miracle, but medical marijuana in a form to be administered by a metered dose inhaler. Seems like that could be a whole lot of different things.
No, you'd have to, and that's a good question. You'd have to look at the totality of the legislation, and the legislation is very specific that it cannot be in its raw form. It can only be in the form that is the lowest dosage of THC, along with the solution that's broken down into a tincture form. The Board of Pharmacy has promulgated a long series of rules, and those rules basically say what can be the concentration of the liquid form that's been processed. So you'd have to look at all of the rules, you'd have to look at all of the laws, and it's very specific of what that liquid can be produced. And that liquid now, if we would allow the metered dose inhalation, it would be only that dosage form of that liquid. Sort of like this example here. It's the same chemical, but it's just transferred to a metered dose inhaler.
Okay, and when you're showing me the handout, one is syrup and the other is what? The thing in the center is a syrup that you would not be putting in a inhaler, correct?
You would put the chemical entity in it. It'd be the same exact same chemically structured entity with the same effects of it.
All right. So when I look at the wording that you've given me, all of us now, talking about metered dose inhaler, short burst, how do you get someone to a comfort level that there aren't other devices on that where I could say if I'm smoking through a vape pipe that's a metered dose inhaler? So help me understand what it is not.
It is very specific, and it's almost a kind of a patented technique. It's very, very specific that you get when you hit the canister, you get one specific dose of that medication at that time in kind of a form that's almost kind of like an aerosol form. So you're not smoking at all. It's just a puff of the medication. I mean, you've seen the asthma inhalers, or you've seen those type of things. It's not really at all the same at all, Senator Claytor.
And as we went through this process, in particular as it relates to this, if somebody needs it, those that the idea is it delivers it more quickly and it doesn't tax their other organs. It taxes their lungs instead of their liver. Is that right?
It's a quick distribution because it doesn't have to go through the GI system. It doesn't have to be metabolized through the liver. It's specifically there. And I will tell you that I believe some of the members did receive calls from some folks that this delivery form is what they really need to complement the liquid. Because you could have some times that the liquid is used for maintenance, but if you do get that occurrence for pain and you need it right away, you'll get it. So many times they're used in conjunction.
Senator Riser, you got a question?
I got a couple of questions. I think you just answered the last one, though. From the parents I spoke with, and I voted different on this in 2015, and now I see the need of the list. So when someone is taking the oral dosage, so your pharmacy might better tell me a little bit more different, but that's instantaneous, and tell me about the half-life and what that means. So because you're taking two, you mentioned that just now, Senator Mills, that someone ingests it and it stays in the system longer, but you have the half-life, and maybe walk us through that and why. The reason is because if you ingest it, if you're having a situation where you need it, my understanding is, so can you walk me through that part?
Sure, it's a good question. I mean, if you're taking something orally on a regular basis, you should have it in your bloodstream at a good, consistent level. And it does take a while for it to get out of your bloodstream. That's the half-life. So it could be a while. You could stop your medication. It's in your system for a while. With this, you get the quick dosage form. The half-life is real short. It doesn't stay in your bloodstream long. And it's just kind of, it really parallels an asthmatic. You know, if an asthmatic needs treatment right away, that inhalation will get you that need that you want. Same way probably I can imagine for an epileptic patient.
And that's my understanding of the individuals I know that's had combat experience, post-traumatic stress, that is something that hits them all of a sudden.
That's right.
On that. Now, the second part of the question I have, and I was told yesterday, when you go to the pharmacy, every time you get the dose, there's an interview that Louisiana's doing. It's about an 8-minute deal that they go through and follow and ask you questions. Are you familiar with that part?
Yeah, and you know, you have to counsel the patient. There's certain things you have to do. You have to make sure that they understand how to use it. So in any medication, it's a legal requirement that the pharmacist does have to counsel that patient and go over the proper usage of it. You're correct.
That's all I have for now. Thank you.
Thank you, Senator Reiser.
Senator Appel, you got a question?
Two questions. One is, did you say any pharmacy can distribute this?
I'm sorry. I was giving this example here. I was giving an example that any pharmacist, when somebody does get a prescription, they're mandated to either counsel them verbally or by documentation. But it's system-wise.
My real question is this. Can you point to any documentation where the FDA has certified that this type of an application of this drug into the body is safe, has done long-term studies?
Well, I couldn't pinpoint it. Now, there is some studies out there that's showing the effects of this. And I said this many times in committee, and people got tired of hearing FDA-approved drugs, as you can kind of see with the Morris Bart commercials, will show you all the side effects and all the problems you've had with it. So for me to go specifically for FDA approval, I think there's been enough studies that show that FDA has shown that meter-dose inhalers are quite effective for a quick burst of the medication going into your bloodstream. But to say specifically for this, I'd have to do some research, but I'm sure it's out there.
Well, I'm sure it's not out there, frankly. I just choose to disagree with you. I think that there's been no studies that indicate this is safe or effective. However, I do recognize what you're saying, that the dosage probably would be enhanced. So now, from a pharmaceutical perspective, if you're going to ingest this stuff directly into the lungs, who's determining the safe dosage? I mean, if you're smoking a marijuana cigarette, you get X amount of the chemical. If you're taking the other stuff through the skin, you get X amount of chemical, but now you're putting it directly into the bloodstream.
Sure. Well, first of all, I should have answered your question better the first time. There's been an extensive amount of studies in Israel on this. Israel is extremely progressive on this issue. I think what I've read, they're cutting edge on the issue. The second issue is the Board of Pharmacy has done an extensive amount of rulemaking. As you know, the rulemaking is through a public process. They have determined throughout the United States and throughout what's out there, what is its safe dosage form, what it needs to be manufactured, and that's what LSU and Southern are manufacturing as we speak. So there's been extensive public hearings, extensive input from the Board of Medical Examiners, the Board of Pharmacy, and if you look at the rules, they're quite extensive. So it has been studied for consistency, at least for production.
But it's safe to say, though, that the Federal Drug Administration has not come up with established guidelines for dosage, efficacy, the amount of, the length of duration of the ingestment. So what you got is you've got qualitative data, it sounds like. You don't have quantitative data based on long-term studies. So I'm just wondering, how do you feel it can be safe?
I think it's risk reward. Like in any other drug that you have, if you look at the side effects of any drug, it's risk reward. Every drug has a tremendous amount of side effects, adverse reactions, contraindications. Once again, this is specific for debilitating conditions when this is the last ditch effort. So this is not the first line of treatment. This is almost like we have tried everything. It's a debilitating condition and it's a risk reward. It truly is.
Okay, thank you.
All right, for the floor on the amendment, Senator Johns.
Members, I'm going to rise in support of this amendment. I think most in this body know that my previous career that I was a pharmacist for 10 years, and I actually still am legally a pharmacist. I have my license is intact. Haven't practiced in a number of years, but I keep my license valid. This body approved medical marijuana a couple of years ago, whatever, and it's going to be on the market in the next few months. Whether we like it or you don't like it or whatever, that's a different argument, a different day. But there are some people out there that just cannot tolerate oral medication. Just talked to one of my colleagues in the back, said he was in college before he could even swallow a pill. Senator Mills has gone to great lengths to tighten up the language of this amendment. I would tell you a couple of days ago it was not tight, but this is tight. The Board of Pharmacy has, by rule, has to promulgate rule on this. This is no different than my child or your child or our grandchildren or one of us who has asthma utilizing an inhaler. This is not inhaling raw marijuana. So I'm going to rise in support of the amendment. I think if it's going to be legal and it needs to be administered in a very safe fashion, I think this amendment does that. So I rise in support of the amendment.
Senator Donahue, you wish to speak on the amendment?
Thank you, Mr. President. So, members, I voted against this bill yesterday. Was it yesterday?
Saturday.
Seems like yesterday. It was yesterday. And I tell you, I've voted against every marijuana bill that's come through the body that I can recall, because I don't believe in proliferation of illegal drugs. And, my partner, Bob Favret of Donahue Favret Contractors, died in 2010 and was a victim of lymphoma cancer, which my wife also suffers with now. And the medical marijuana, listen, that was a number of years back. He got it in the hospital. It was seen to be legal at the time, but as he suffered through what he suffered through, I know that helped him. And I've gotten 3 phone calls over the last day or so. One from a really good friend who's in a lot of pain, and and he needs some help. One from a doctor, a friend of mine, who is suffering greatly with prostate cancer and needs something like this to help him get through the day. And I had a call from another doctor in my district whose wife died recently, and he relayed to me how she died and how this inhaler could have helped her get through what she had to get through. So I'm going to be voting for this amendment, and I'm going to vote for that bill because I know it's an illicit, illegal drug, but you know, everything we use to help people with pain in this country is an illegal drug if it's used improperly. I had a long talk with Senator Mills this morning about the bill because I really don't want to be backing something that I think is going to hurt the state of Louisiana or its people. I don't want to be part of proliferation or something like that, but I have to be part of helping people who need help. And I tell you, I had so many phone calls from people who need help. I can't help it. And I think about what would happen if my wife needed that. I tell you, I'd go anywhere in the world to find relief for her. And I'm going to vote for this.
Senator Morrell.
Members, I rise in support for very similar reasons to what Senator Donahue already said, but I'd like to point out something else to you. Ladies and gentlemen, we've had plenty of bills to not only allow patients to get expedited use to experimental drugs for terminal conditions, but to do so over the objections of insurance companies and doctors. Think about that for a second. One of the main arguments you hear about this particular legislation is that somehow it's dangerous. When we talk about the kind of people that this inhaler could help, and we talk about the challenges and dangers they face, we as a legislature have consistently voted over and over and over again for dangerous experimental drugs to be accessible by individuals, even without full FDA approval, when it is a medication of last resort. We've done that over and over again for drugs that are far more experimental and far more dangerous than what's before you today. And we've always held to the point that when people are in that period of their life, when they're facing that challenge, it's an exceptional circumstance. And I would simply say, let's be consistent. I mean, we've continually voted. Representative Stokes had a bill this year dealing with the same thing. You're facing cancer. You want to try out every drug there is out there. And we keep saying, sure, it's your life. You're the one suffering. Let's provide every possible remedy that you can see. This is just simply another remedy. Please look past your preconceptions on this issue, and I think Senator Mills has done a tremendous job in narrowing this bill as succinctly as possible to help people who really need it. Thank you.
Senator Clay, do you wish the floor?
Thank you, Mr. President, and thank you, Senator Mills, for bringing this bill and trying to get around to addressing the objections that I had and that we passed on this. Senator Morrell says he's going to be consistent. I'm going to be consistent as well. When we had the debates on this, we said we weren't going to go down the inhalation road. So I have friends that have been calling me, say they want it. I have people I don't know calling me saying that they want it. So I'm going to give an explanation, which is I am going to continue to be consistent, just like Senator Morrell has encouraged me to be. Thank you.
All right, Senator Mills, you want to close on the amendment?
Members, that actually to consider amendment, I heard everybody loud and clear. We went back to the drawing board and said, can we make sure that we identify what is true inhalation for medical purposes? And I will tell you that the law is very specific that inhalation cannot be for any kind of raw form, any form that's not been delivered. And I will tell you, this issue has really weighed on me for years and years because I've had so many people that have contacted me to say, as Senator Donahue said, I have somebody dying of cancer, I'm going to Colorado, I'm coming back, their pain has been relieved, what can I do? I do not want to break the law. And ladies and gentlemen, as a pharmacist, I can tell you how many times I've filled prescriptions for hospice patients, people dying, people needing pain medication, and we've all been there with our families. We just saying, here's an option for a professional doctor and the patient to make a decision, and I'd like you to give them that opportunity. So I'd like that you move favorable on the amendment.
All right, so any objection to adoption of the amendment? There is objection, all right. When the machine's open, those in favor will vote yes. Those opposed, no. Secretary, vote your machines, please. Vote your machines, please. Vote your machines. You through voting? You through voting? All right, close them up, please. 30 yeas, 7 nays, the amendment stands adopted. Any further amendments?
Next set of amendment by Senator Clater. Which set you want first, sir? They look like the same ones. It's a 3274 and a 3222. This one's the later version of that. All right. 3274. Senator Clater sends up amendments that set number 3274. Here you go.
Let us get it out there, Senator.
Give me one of those.
Yeah. All right, Senator Clater.
Thank you. Ladies and gentlemen, you hear about making this available for people that have pain and all the issues that they have going on. I certainly don't doubt that. My oldest brother's dying from cancer and is using these products. Lives in Connecticut, doesn't use an inhaler, but is able to have access to medical marijuana, and it helps him quite a bit. When we were doing this work originally, I said, if you recall, that we only have 10 pharmacies that are going to be able to do this. Sounds a whole lot like riverboat gambling to me, that we're handing out licenses really just for people to make money, not so much for people being able to get the treatment they want. So since we've decided that this is something that provides people relief, gives them the treatment that they need, let's triple the amount of pharmacies that are out there and make sure that people are able to get these products. You see, there's 10 regions in the state, and there are only 10 pharmacies. So if this is so important that people be able to get this product, let's go all the way up to 30 pharmacies. That wouldn't even be one in every parish. So want to make sure that these people can get the relief they need.
Senator Mills, you have objection? You want to speak on it?
Members, I'll kind of tell you, on Saturday I received 19 votes, and I'm hoping not all my votes in the bathroom because it's going to be close again. So I'm hoping everybody's here. This is an issue that I made a promise when we kind of had the discussions that whatever law enforcement needed at the time, and we butted heads a lot on this, but in a give and take session, I said, what would you like? They said, what we would like, because it left this body with no limitations of licensures, of permits. We basically said it was a free market system, and I support a free market system. But law enforcement and the DAs at the time basically said, and the House amended the bill saying that they would like to limit it to 10 to see how the issue goes, and then look at the issue again, and we'd all look at it. I think if this amendment stays on there, it may kill the aspect of the inhalation piece and the piece that I would like to see people get the opportunity to get. I think this is a worthy amendment, but I think it should be debated in the full section, because I think this right here would cause a lot of problems, and I just I think the inhalation piece to get people, as Senator Donahue said, that much needed medication, I wouldn't want to cloud the issue here. I think it's a good topic, but I think it's for another date. So I'd ask you to keep the bill pretty much cleaner than the way, clean like the way Representative James brought it to us. Thank you.
Senator Morrell, you still want to speak on the amendment?
Thank you, Mr. President. Members, I've spoken to the author. He certainly does not approve of this amendment. Ladies and gentlemen, we have had ample, lengthy debate on this topic. This is simply a kill the bill amendment. So if you want to kill the bill, you cannot have someone in the same breath talk about the dangers of inhalation and how it's not properly regulated and then go, now I want to essentially further deregulate it. So let's be consistent. We're trying to stick within the rails of what we're dealing with. I think that if you want to look at expanding the amount of licensees, I think, like Senator Mills said, the appropriate time is to let the actual rollout happen, let the demand dictate that, and if you want to come back in future years and make it 30 people or free market, there's an appropriate time to do that. It's the same reason why, ladies and gentlemen, that when we first decided to allow these products to be grown, we heavily regulated it by affiliating them with universities. You have to wait to see how it goes out. And at that point, I think when you're talking about how many dispensaries or whatever's going to be out there, there's an appropriate time to have that debate. That is not today. And if you vote for this amendment, you're voting to kill the bill.
All right. Senator Clay, you have a right to close on.
So which green is this about?
Hold on a second. Senator Donahue, you got a point of order? All right. So
Oh,
we'll
look
get
at that. Jack the parliamentarian.
All right. Senator Clay, you through closing? No, sir. All right. Senator Donahue suggests the absence of a quorum. Mr. Secretary, open the machines for quorum call, please. Quorum call. Vote your machines, please. Senator Martini is here. Senator Barrow is here. I call them up. 37 members present in a quorum. Proceed, Senator Claytor.
So as I was beginning to say, which green is this about? Is it about money or is it about access? If it's about access, let's give people access. 30 clinics, well regulated, through a process. I ask you to vote favorable on the amendment.
Senator Claytor has sent up an amendment to which there is objection. When the machines are open, those in favor will vote yes, those opposed no. Secretary, vote your machines, please. Vote your machines. Vote your machines. Are you through voting? You through voting? Senator Barrow, yes. No, I'm sorry, no. Couldn't see you back then. You through voting? All right, close them up, please. 10 yeas, 27 nays. The amendment fails to pass. Any further amendments? No further amendments. All right, Senator.
I have amendments by Senator Barrow.
Senator Barrow has one. She's right there.
There's set number 3240. 3240 by Senator Barrow.
I withdraw.
She withdraws them. Okay.
Okay. I have no further amendments.
All right. Senator Long, you wish the floor on the bill? Come on down.
Thank you, Mr. President and members. These are truly times that try men's souls. As we look at this, we also look at the compassion that we need for our fellow citizens. But I would remind you that great work is being done right now by the pharmaceutical industry and by research that deals with some of the very issues that we talked about. Now, what we have not talked about, which I reminded you of recently, is that every state that currently has recreational marijuana purchases started out as a medical marijuana only. If Colorado could go back and change the scope of what they did, they would change it. Because what we're doing, whether we realize it or not, yes, we are dealing with future generations. And I will tell you that the number one, as I talk with district attorneys, the number one issue is drugs. The Federal Drug Administration defines marijuana as what? As a drug. Now, I understand what we're talking about when we deal with medical marijuana, but I'm here to tell you, when we open Pandora's box, when this becomes a household issue, when it becomes common on the streets, one day many of you who will be serving in the next 4 to 8 years will come back and you will deal with this again, because it's an issue that absolutely is going to create, in my opinion, havoc and confusion with the citizens of Louisiana. I understand the compelling reasons to identify with people who are hurting, but I will tell you there's a much bigger issue here than this bill, and I would ask that you object and oppose the bill.
Senator Boudreaux, you wish the floor.
Thank you, Mr. President. Members, I rise in support. I heard the debate on Saturday, and I want to applaud Senator Donahue. That's the calls I've been getting. You know, I was in favor of the hemp bill. I understood what it was going to do for people. This is going to do something for people today that have been waiting a long time. One size doesn't fit all. Now, we've had some great speeches on our way out, and Senator Long, I agree. It's going to continue to come up. But as I heard on a number of occasions, we have some good people that will follow the people who are leaving. And when that day comes, we'll have to make that vote. But I have friends and I have family who have traveled to Colorado, and the question that I can't answer is, why can't they get it here? Why do we force them to go out of state? I too want to commend the chairman. Senator Mills is probably the most expert on this, and I'm going to follow his lead. But when that day comes and we're going to have to vote on where to from here, the people of this state hopefully will stay engaged, and they will empower us to make that decision at that time. Today, however, this vote is on something that we have all of the safeguards that makes me comfortable enough to support it. Thank you.
All right. Senator Clay, you now wish to speak?
So what does the bill do now? It allows out-of-state physicians to prescribe it as long as they can have a Louisiana license, and it has this inhalation part that Freddie has worked hard on to put in position to hope to make you comfortable with. We haven't provided any medical marijuana to anybody yet, not a single person. Not that we're the model state for getting that stuff done. So saying no at this point, I would expect would have absolutely no impact, because I don't know when you'll ever see this on our shelves. But I'm going to vote no and be consistent and ask that we go slowly. There'll be a lot that don't vote no, and I appreciate your side of the argument, but my friends have asked me about this and pushed me hard to say yes, but I just don't believe we're there yet. So I'd ask that you vote no with me and Senator Long.
Senator Morrell, you wish to speak?
Thank you, Mr. President. Members, I felt the need to rise. I rise in support, obviously, of the bill, but there's been an equivocation that's been made several times, and I think you need to logically refute it. There has been an argument made multiple times that every state that has passed medical marijuana has recreational marijuana. That is not a complete logical argument. Every senator is a human. Democrats are humans. not every senator is a Democrat. That's the same logic flow that flows there. The reality is there are numerous states that have legalized medical marijuana that have never gone to legalize recreational marijuana. That is a fact. There are some states that have moved to recreational, but there are states that have not, nor is there any movement necessarily in those more conservative states to go to recreational marijuana. So just A plus B does not always equal C, because there's already variables in between. And I would simply say, do not think or be confused that a vote today to provide medical marijuana to people suffering from debilitating diseases means you're voting for recreational marijuana. As Senator Boudreaux so aptly stated, I will not be here, Senator Claytor won't be here, Senator Long won't be here. You will have the opportunity to make that vote and to vote your conscience on that issue. That is not the issue before you today. The issue before you today is if there is a person who is suffering from a debilitating disease and we can bring them some kind of remedy when no other drug has done so, we should give them the opportunity in our own state to do so, because let's be clear, for those people of means, they can go to Colorado and get their ailing relative, spouse, child access. For those people who do not have means, they simply have to suffer in silence. And that's not fair. Thank you.
Senator Chavez.
I rise along the lines of everybody else about the other concerns that we have. You've heard me speak on this topic a number of times. I believe in opening up access. I want to correct something that was said from the mic earlier as it relates to other states. U.S. News and World Report 2019, best economies in the country. Colorado, Utah, Washington, California, Oregon. All of those have legalized medical marijuana. Colorado, Washington, California, Oregon, not Utah, all have recreational marijuana legalized in those states. I'm not saying that there's a direct correlation to that, members. I'm just trying to say, look, just because you have a difference of opinion on things, you don't have to come up here and try to demonize the opinions of everybody else and say that the state's going to go to hell in a handbasket if we do this. Because I tell you what, when you stop putting up those philosophical impediments to progress, things do get better in your state.
Senator Long, you want another shot at it?
Members, I just want to make a clarification so that you understand what I said. I said that every state that has passed laws dealing with recreational marijuana started out as a state that only approved medical marijuana. I'm not suggesting that every state that has medical marijuana now has recreational. I'm saying as a starting point, every state that currently, that I spoke of, that started out as a medical marijuana. I just wanted to clarify that.
Senator Luno, you wish to speak now?
Thank you, Mr. President. Members, I'll keep this brief. I think about what I would do if I had a child that needed this medication to help with seizures. And I personally know somebody that had a child that had seizures, multiple seizures per day, and started using this product, and the seizures went down to just a few times a week. And what would that be worth? It's time we take a chance on this. We need to pass this legislation. I urge your support.
All right, Senator Mills, you have the right to close.
Members, thank you so much for the consideration and debate, and I want to thank Representative James for his work. He's worked hard on this issue. Y'all, it all boils down to this. It really boils down to this. We've identified what metered dose inhalation is. It's going to be the exact same drug. But this is what you have to look in your heart, is if somebody has a debilitating disease and this quick-acting metered dose inhalation will give somebody quicker relief from pain, a seizure, a disease, and the doctor makes a professional decision that could affect his or her licensure, and the patient has decided from all avenues that this is what we need, who are we to stop that? Who are we to stop that? Let's just give these people an opportunity. That's all they ask. If you have a debilitating disease and this is a last gasp effort from a meter inhalation, let's give them that opportunity. I would move favorable.
Senator Mills has moved final passage. When the machine's open, those in favor will vote yes. Those opposed, no. Secretary, vote your machines, please. Vote your machines. Yeah. Vote your machines, please. Are you through voting? You through voting? All right, close them up, please. 31 yeas, 7 nays. Bill's final passage. Move to consider vote of the motion object. So.